Okay, so we're gonna muzzle Dewey, show how that's properly done. Sometimes it's really easy to muzzle patients, but then the other times you have to be really, really cautious because they're already trying to snap at you and get at the muzzle. But in this case, he's just really nervous, so we're doing it for some extra precaution. So the best way to do it is to just make sure they can't necessarily see you coming and try to get it on as fast as possible because they're going to try to whip their face around and paw at it. Make sure it's loose enough that you're not having to unloosen it when you're working on getting it on. It's easier to tighten it when it's on than it is to try to make it looser. So there we go. Make sure you have a nice fit around the muzzle so that it's not too tight on them, but they can't get their mouth open to bite you. Okay, we're going to demonstrate how to trim a dog's nails. So depending on the size of the patient, that's how you decide what size nail trimmers you're going to want to get. So for Dewey here, we're going to use the small nail trimmers because he's a small dog. With larger dogs, then you're going to want to use the bigger ones. This works for cats as well. So we're just going to start with this first paw. So he's got nice clear nails. It makes it a little bit easier for us to tell where we're trimming, but we don't want to just look at the side and say, oh, we're going to trim way up here. You want to take a little bit off at a time. So I actually start underneath here and just shave a little bit off at a time, going around the side until we start to see the quick exposed, but without cutting it and making him bleed. So we're gonna call it good there because he's getting a little bit sensitive. We can't see the quick there, but it's getting pretty close, so we'll call it good on that one. So then we'll just repeat on the other nails. Now I've made him a little bit nervous, so he might be a little bit more sensitive on these other ones, but so just continue on. And as you can see, we couldn't trim it quite as short as what we're seeing on the side over here. We just want to pay attention to what we're seeing underneath here and just take a little bit off at a time. It's nice to kind of shave it off instead of clip off a big chunk and then realize too late that you took off too much. So, alright. We're going to show how to use a rabies pole today. This is Miles. He's a very dangerous dog, so we have to use a rabies pole every time we go to get him out of his kennel or do anything with him. So before you do anything, make sure this is nice and loose and it's working properly, because we want to just kind of lasso this over his head. And so once you get it over their head, then you can tighten it as tight as you need them to. A lot of times they'll be thrashing around and you can see a lot of bite marks on there. But obviously he's a super nice dog, so we don't really need to use this. But it makes it safer to do the video with a dog that's not trying to kill me. So. And that is how we use a rabies pole. Our fractious patient, again, Miles. Sometimes the easiest way to lasso a patient is actually using a nice thick towel. Sometimes you can wrap it around their neck like this to make it safer for you to get underneath here. They're kind of limited in their motions. Other times you want to just cover their head so they can't see what's going on and you use it to just scoop them up like this. Works great for cats too, if they're thrashing and biting, to kind of wrap them up nice and tight in a little burrito. Obviously he's not a cat, but to wrap them up nice and tight, and then you can make sure their claws are contained when you go to draw blood. Good boy. Alright, that's it. So we are going to catheterize, this is Shylock, and he just had an exploratory surgery. So first thing we're going to do is expose the penis. You can feel the os penis in here, and then apparently he's a little bit difficult to catheterize, but we're going to do our best to wrestle with this and hope that it stays. Maybe. It's not going all that well. Can you pause it? Got it for him, but... I know.
Ready?
Okay, now we have the penis exposed, so I'm going to lubricate the end of our 8 French red rubber catheter in the hopes that it's not too big. And then we'll gently, hopefully, feed it until we start getting urine. I think I should have done a 5. It works, but you can tell that it's a tight squeeze. Okay, so we've got it pretty much as far as it can go. We can still push it a little bit farther, but we don't want to end up injuring the patient. Now we can attach our syringe and subsequently drain the bladder. And when the bladder is drained, we will remove the catheter.
So are you going to describe?
Okay.
Do I have to describe?
No, it's fine. I can. So this is Dr. Bonds, and she's going to be catheterizing Willie. It's best if they're sedated prior to trying to expose the penis, and you do want to use scrub to clean the area. So I will hang on to his legs while she tries to expose the penis so we can feed the catheter.
Sometimes it's difficult. Yes, right.
Pyro's coming over. We have got a pyro coming over.
Yeah, he's not.
My kid back up, but how old is the doggy? 13. 13 years old.
They're gonna, if that's one of their issues, help them take the call.
Okay. Dr. Les said this.
And some issues with my male dog catheterization too, so. It's not lubed. Safe. Can you grab us some lube? Or clean lube? Clean lube. There.
Where's Dr. Rick from?
Rock Island.
She didn't say.
Usually I like to have the penis more exteriorized, but he is not thinking that's a good idea right now.
Is there anything I can do to make it better, easier?
Don't
Want him to stop? William?
He says it's fine, my penis is fine. This should not be this difficult. Probably pause it till we get it in.
No, it's fine. We can probably just. Okay, bud.
Sorry, kid. Being mean. I feel like I'm torturing him. Can
It's fine.
relax him
We
a
could
little bit.
probably just describe the process.
Okay.
So, ideally, what you want to do, we're going to have to give him some more drugs if we want to catheterize him. But ideally, you want to exteriorize the penis and then feed the catheter in. It's lubricated with sterile lube. And feed it until you start getting urine. Oftentimes, this is used with cats that are unable to urinate on their own because they're blocked with a stone. So,
He's too awake.
yeah,
He's
it's
spasming.
fine. So we're gonna go ahead and give him some more drugs and give it another shot. We're gonna get a urine sample on Roxy. Avoided urine sample, which can be somewhat challenging sometimes depending on the patient. So we're going to let her go to the bathroom and then try to slide this underneath her in the middle of her stream. And make sure they don't pick it out. Express Fiona's anal glands while she's under anesthesia. It makes it a little bit easier so she's not uncomfortable. We're going to check to make sure that they're empty. And then we're going to also give her an enema afterwards because she's been having some issues defecating. So I have a glove on, obviously, and I have lubricated my right hand because that's my strong hand. So you go into the rectum and you're going to feel for little pockets, see if they are full. She has a very, very small amount on the left-hand side, so I'm putting gentle pressure on that to express it. And got a small amount. And then I will check the right side as well. Should have a little bit on that side. There's a little bit on this one too, so. Some gentle pressure and got a small amount, but that'll help her feel a little bit better because she's been scooting a little bit, so. Okay, stop. Okay, so now we are going to show how to give an enema. We have our... Okay, so we are going to give Fiona an enema. We have our enema catheter, which is lubricated very well. And we'll just show the part where we, how we place it into the rectum and the colon. And you want to just gently feed it in, and we're going to, we've been having some constipation, so there's a little bit of resistance, but going to want to go up to the diaphragm, so we measured. So, alright, and then when you're ready, we have a specific amount of warm water to administer. So when you're ready to give that, then you just release this, and then the water goes into her colon and will help her feel a little bit better. You're on. Today we're gonna be trimming Willie's nails. I'm gonna demonstrate how to trim a cat's nails. So he's luckily a very, very nice kitty. He's just kinda wiggly. So sometimes you need to lay them down. It's kinda nice to be able to lay them down, but with him, we just kinda let him roll around and do whatever. So cat's nails are usually clear, so you can just look at the side and trim carefully. This one has a nice hook on it, so you just want to watch out for that pink quick. Don't cut it past that. Willie's a good boy. Okay, overhead. Okay, and then I will continue on the other 3 paws. He only has 3 legs, so. Today we're going to demonstrate how to hand pill a dog. This is Dewey. He's very nervous, so we're going to put the pill in one hand, and then make sure you have a good hold on the dog, and grab on either side of the face, careful not to get bit, and put the other hand way in the back, the pill way in the back of the mouth, and then make sure the mouth is kept shut. And sometimes it helps to kind of rub the throat a little bit or blow on the face to make sure that they've swallowed. Once they start licking, you're usually pretty safe. We're going to hand pill Willie today. So it's a little bit different than with dogs because they have very, very, very sharp teeth. So what you're going to want to do is grab on either side of the face and then open with your right hand and shove it way in the back and then Hold her mouth shut just like you would with the dog. Oh, good kitty, and there we go. Fiona's ears out and medicate them. She's been shaking her head a little bit, so we're gonna try cleaning them out. She's a little bit feisty. She is a Chihuahua. Pretty typical. So you put your ear cleaner down in the canal, and then you get your cotton in there and massage it. Oh, that feels good, puppy.
There's a DA for Franny.
Okay, now we've got our ears clean, so we're gonna administer our meds. Just a couple of drops for this mean dog that bites. Yeah, you do. Don't ya? There we go. Massage it. There was a good girl. Okay. Today we're going to be cleaning out Willie's ears. As it turns out, he has some pretty gunky ears. The right looks has some discharge in there, so we took a swab of actually both the right and the left. Found a small amount of yeast and cocci in the right, and then a small amount of cocci in the left. So we're going to first clean out this ear that has the discharge in it. So you want to put a reasonable amount of this is Oda-Cleanse that we're using. It's nice to have somebody hold for you so that you're not wrestling and, oh, this is going great.
Might have to lay him on his side.
I know, buddy. So you want to put a decent amount of the fluid in and then massage the ear canal. I know, buddy, I know. And then use your cotton to get the fluid and the discharge out. Don't want to have too much discharge in there because then the medication isn't going to, it's not going to do its job. So getting a decent amount out on this first go. Oh, buddy, I know. We'll let you shake it out. Oh, boy.
It's alright.
His ear is all red. So we'll do one more. Make sure it's not filled with fluid. I know. And then we'll put the drops in. We'll do drops in both ears. The left ear doesn't need cleaning. So we're going to put 4 drops of Tresederm in each ear. And then massage the ear canal. Oh boy.
Good boy, Willie.
Yeah. You're going to feel better. Okay, I know. All done. Okay, and then... Okay, we're going to be applying Frontline to Fiona today, and
At least it looks pretty clean.
before we do anything, we want to make sure all the fluid's down at the bottom, so I have a tendency to flick it a little bit until I see it all go down, and then point it away from your face when you open it, crack it, and then just part the fur and put it all in one spot.
Oh, there it is.
For some reason, she really hates this. Alright,
It's gonna be a very
all
fun
set.
trick.
Takes a couple seconds for the sound to get going. We're going to do a gastric intubation on Fiona while she is already intubated. She has an endotracheal tube in. So, first thing we need to do is measure how far we need to go to administer if we're doing barium, or sometimes we administer lightly this way too. So, to the last rib cage, and we're looking just before, let's see here. Okay, and we're gonna go about that far. So then if we can find enough room in her mouth, and start feeding it in. The nice part about when they're already intubated is there's nowhere else for it to go other than down the esophagus. So, and we have it fed as far as we need it to go, and then we would hook up a syringe to administer whatever medications we would need to, or New Lightly or barium. Okay. Demonstrate how to do 3 different tests, ocular tests. We're going to start with the tear test before we do anything, because we don't want to add anything to the eye or flush it out with saline, because that'll affect our test results. So we have our tear flow strip, and we bend the little tip right here, and we're going to put it underneath his eyelid. He's such a good boy. And then gently close it. And we're going to keep it in there for ideally a minute. Already it's racing to the point where we need it to be. Miles is such a good boy. Yeah. So that would be all we would need to do, is hold it in here for a minute and then read where we're at. We need it to be in between 15 and 25 for it to be considered normal. And then once it starts getting less and less, then that's when we start to become concerned that they have decreased tear flow. So he's doing really, really well. Okay. Next test. What we're going to be doing on Miles is the fluorescein dye test to check if he has any ulcers or scratches. So before we do anything, we just want to put a drop of saline on the very edge of the strip, and then we touch it to his eye. Hi, buddy. Whoop. Make sure his eye is actually open. And done with the strip for now, and then we'll grab some 3x3s. So it's going to make a little bit of a mess. And then you want to completely flush out all the stain that's in there and see what's left. Oh. So we want to flush out the excess stain and see if there's anything left in there. Sometimes it helps to use a black light to see what's going on, but in this case, Miles is looking fantastic. We've got all of our dye flushed out, and we don't see anything left on there, any ulcers. So, boom. Okay. Test. We're going to check Miles's eye pressure using the tonal pen. But before we do anything, we need to put proparacaine in his eye to numb it, because we're going to actually be touching the tip of the tonal pen to his eye. So I'll just put one drop. We need to calibrate the tonal pen before we can use it, so I've placed the tonal pen cover on already. You want to make sure it's not pulled too tight, but it's nice and smooth on the top, so we've got a little bit of slack on the sides over here. And then you press your button down here till it says calibrate. There we go. Hold it still, and it'll tell you when to turn it up. In about a minute and a half, we should be, there we go. It'll tell me if it's good. There we go. Now we're good to use this for the rest of the day. Okay. You don't want to put too much pressure when restraining, because it can actually affect the, you can hear. Okay, 16. We'll do 3 of these. Sorry, bud. Okay. We'll be doing a bandage on William today. We're doing a modified Robert Jones. So first thing you want to start with is your stirrups. Get tape. Make sure it extends down far enough. We like to put a little popsicle stick that you can attach both strips of tape to. This step is actually really, really important, so that you can make sure to keep an eye on the toes. We'll pull it up after we've done all of our layers, so that owners, or we, can keep an eye on the toes and make sure they're not swelling. And so the bandage doesn't slip down. So, okay, so then we have our cast padding, which we want to make sure that it's snug but not too snug. Do a couple layers of that.
Brady, you close, or if you need anything on deep. Whatever you want to. Yes.
So it's nice to go up above the elbow so that also helps prevent it from slipping down. And we'll go back down with our cast padding. Nice soft bandage for Willie. He's alive, he's just sedated. Don't worry, guys. And then we're going to use some cling to help put a little bit of pressure to prevent swelling. But make sure you're not pulling too tight, because then you're going to end up cutting off circulation, and that's when you're going to see those toes swelling up. Or you can cause pressure sores as well. There are different techniques to making it nice and tight, but we're just going to wrap it around for the benefit of this video. And then after this we will do vet wrap. Your bandage scissors, cut off our excess. Okay, Willie?
Oh, anyways, purple or pink?
Purple's fine. He doesn't mind. He's very feminine. So make sure with your vet wrap that you're not pulling straight from the roll. You want to loosen it before you wrap it around, because that's also going to, it's deceptive on how tight it's going to be. You want to loosen it before, and then you get to decide how tight it's going to be. So then, once we have that all wrapped, at this point, this is where we would take our stirrups. So under your tape, and then twist and pull up and secure to the bandage. And if you don't like the way that looks, you can always cover it up with vet wrap, but just for the purpose of aesthetics, you can just leave it. It's not going to hurt anything. So I'm going to just also show how you would remove a modified Robert Jones bandage safely. What I like to do a lot of times is just make sure that you get your scissors. You know exactly where your scissors are going. Find the toes, find underneath your bandage. Make sure you're not going to be snipping anything you shouldn't. Depending on the amount of padding, like with a cat, there's not a whole lot of padding, so it shouldn't be too difficult to do, but sometimes it's easier to just, if you can fit your scissors in between where you have your vet wrap and your cling, it makes it a little bit easier, but you just go up, cut that off. And then, now that you've cut off already another layer, makes it go a little bit faster. So then we will remove that, get all this off, and then we will remove our tape carefully. It helps to go with the grain instead of against it. Voila! We're going to place a splint on Willie's front leg. So first things first is our stirrups. Piece of tape, secure it on the top.
Kendra? Yes. Do you know where 14 gauge needles is? 14 gauge? Don't have any up here.
I'm not sure we have 14 gauge.
I think we only have 16.
Check in the drawer. And then our piece on the bottom. Make sure these are stuck together. 16. And then much like the modified Robert Jones, you're going to want to do your cast padding first.
I'm not seeing any.
Wrap it up.
Do you check with you? Yeah.
I'm not aware that we
I
have...
know we have 14 gauge catheter,
Is that what he's asking for? Because are they doing a tap?
But that's in special procedures. So,
Okay, you don't want your padding to be too thick for your splint.
or
So we're going to do that. And then our cling. Make sure it's nice and secure. Although it doesn't.
Bethany found in this one.
Needles or catheters? Big difference, darling.
She wants some.
And it's nice for casts and splints and stuff to make sure that you have plenty of excess padding up top and down below. So at this point, so you don't get a pressure sore, that's why. So at this point, then we will place our splint. And then in order to secure that, we're going to use more cling. We took 3 readings on Miles, and they were all in normal range. The first one was 16, which is just slightly above normal, but that's okay. But the other were 10 and 11. So you take 3 readings, and then generally the veterinarian will take that information and go from there. For instance, Willie came in and he was bleeding profusely because he had a large laceration on his leg. We would need to do a quick bandage. This is going to be, spend a lot of time on it. We want to stop that bleeding, put pressure on it. So whatever you can grab for bandage materials, 3x3s, we have Telfa, or, if you need lap sponges, or cast padding, anything to help absorb that blood and put pressure on the wound. So we're just going to quickly act like he's bleeding to death right now, and we're going to put pressure on that wound, and then get your vet wrap. This is, in this circumstance, it's okay to go tight because you really, really want to put pressure on where they're bleeding from, and that way you can focus on whatever other issues they have going on. If they've been hit by a car and they are in respiratory distress, obviously the breathing takes precedence, but we also need to make sure they're not bleeding out. And we'll quickly just remove that as if we were wanting the doctor to take a look at it. Okay. We're going to simulate CPR on Fiona. Much easier to simulate doing CPR on a patient that already looks like she might be dead. Oh, I think she's waking up. We're going to simulate CPR on Fiona. She's under anesthesia for a dental procedure, so it makes it a little bit easier for us to simulate CPR. As long as we know that our airway is patent, we want to focus on compressions, and with a small dog you're going to put, using your strong hand, your dominant hand, I do the 3 fingers underneath her body and then use your thumb to do the compressions from the top. And with smaller patients, even larger patients, obviously you're going to need more to hold them in place, but when you're doing compressions, you're pushing down pretty hard and they get jostled, so you want them to be held as steady as possible. It's a little bit easier with the smaller patients to do compressions than it is the larger ones where you're using your whole body. But we already have our tube placed on our patient who's crashing. Luckily she's not crashing right now, but she's doing really well. But we would focus on doing the compressions 1 to 2 per second. We're going to simulate if we would need to bag Fiona. That's what it's typically called. We need to have the patient bagged. We're not going to use an ambu bag. We are going to use the anesthetic machine, and she's on a non-rebreather, which makes it a little bit more difficult, but it's still possible to do. Just need to keep a close eye on. Usually, you would use this pressure gauge. Sorry, brain fart. To keep an eye on how much pressure. But for now, we're going to have to keep a close eye on her chest, and we close this off and use this to manually bag her gently, and then open it. Make sure you're opening that back up. Huge, huge, huge. You cannot keep that closed. This will fill with air, and the pressure in her lungs will build, and it's disastrous. So, according to the doctor's orders, if they would like you to bag every 15 seconds or however frequently they would like you to do that until we're getting our proper end-tidal CO2 or whatever they are concerned about. So just make sure you're paying attention to the chest, and make sure you do not leave this closed. If we were using the machine, just double check that this is open, and it is. If we were using a rebreather with our tubes and a bag down here, we would close off the pop-off valve and then use the bag that would be hooked up down here. I should have hooked it up so I could show you a little bit better than just an air bag. So we would have a bag and tubes. This, is she doing okay? Mm-hmm. Okay.
The SpO2 just stopped reading on her ear, so I moved it to her thumbs.
Okay. She's being a difficult anesthetic patient for us. Her blood pressure keeps dropping, but when we turn her down, then she wakes up. So anyway, this would be hooked up to a larger patient, and if we were needing to bag said larger patient, we would close off the pop-off valve. We wouldn't have to worry about this. It would be hooked up. And then this bag would fill with air. Sorry, and then we use this pressure gauge to tell. We don't want to go over, is it 20? So centimeters of water. So carefully, it works best if you actually hold the pressure for a few seconds so it can fill the alveoli, and then make sure you're opening your pop-off valve. That's the biggest thing in when you're bagging a patient, is not to leave that closed. You kill your patient. Okay. So we're going to be doing a dental procedure on Fiona today. This is Kendra, our technician. She's going to be helping. So the first thing we're going to do is take dental radiographs to see if there's any disease going on underneath the gum line, to see if we need to do any extractions or any additional work other than cleaning.
We're missing the premolars 2 through 4. Your mouth is so little. Missing premolars 2 through 4, and then the lower third molar is gone.
Okay, so we are using a curette to manually scrape off some of the tartar from her tooth, and then we're going to use the ultrasonic scaler. So we're kind of just getting under the gum line and pulling forward to get some of that bigger stuff off. We already finished our radiographs. We don't need any extractions this time, but we're going to recheck in 6 months because we have a little bit of movement on this tooth. So just hit pause. Okay, so we're using the ultrasonic scaler to get underneath the gum line and clean out some of the tartar. Make sure you have good water flow. You're also not wanting to use the tip, like when you go down like this. What you want to do is use the side of it, and don't stay in one spot for more than 3 seconds. Put etching on the teeth and... Okay, pause it. We wanted to mention about the, when we're using the curette, we need to gently blow air on the gums to kind of flare them up so that we can see underneath the gum line to see if there's any bacteria that we've missed with the curette. And you don't want to blow too hard because it can push the gum line even farther away from the tooth, and you just need to be careful of that. Okay, you can pause it. Go. Okay, so now that we've cleaned the teeth, we're going to polish them, and we made sure to fill our cup with enough polish
Prophy paste.
Prophy paste. So that way, when we want to put enough pressure on the tooth, also, so that the Prophy cup kind of flares out a little bit, so the bristles inside do their work. So then we just go in small circles and try not to polish her gums or her face. Get a little bit of blood. Go. So to finish up our dental procedure, we're gonna put fluoride on her teeth, and we used to use the gel, but now we use foam. So goes a little bit faster. It's actually 60-second application, but we're not gonna sit here and watch the whole thing. But you want to shake it and then put it on your finger first, because it expands much like mousse does for your hair. This is already such a large amount that I don't even need. So we're going to place it on the front of her teeth. On this side, we already did the other side. And then underneath and the backs of them. And then we let it sit for 60 seconds. And then we'll rinse it and clean her up and wake her up. So one last thing I wanted to mention for dental home care is it's really important, if you can, to brush the teeth as often as possible. You know, if you can do it every day, that's great. A lot of pets don't allow you to brush their teeth, so you can use other products like greenies work great, or sometimes people use felt toys for dogs to chew on that help break off some of the plaque that builds up a little bit, and hard food helps to break off some of that bacteria that's built up, kind of clean the teeth. You can use TD as a treat sometimes to help there's some enzymes in there to help break apart that bacteria too. So there's a couple of different things that you can use, and there's products that you can add to water, CET chews that you can give them. I don't personally like the CET chews. They don't smell very good, and sometimes once they start to get soft, much like rawhides, they get stuck in the back of the throat. But greenies, and you can use CET chews, but I would just make sure they're supervised when you give them to your pets. Trying to think of what else you can do. Try to stay away from the canned food if you have a pet that has a lot of issues with their teeth, but definitely bring them in every 6 months to every year to have their teeth checked. It's good to have a dental cleaning every year if your doctor recommends it. Once they get, to be a year or two old, start doing those dental cleanings on a regular basis. And then if you have any issues, if they have any cracked teeth, keep an eye on that. If they're excessively salivating, bring them in, because they probably have something going on. So it's just preventative measures work better than going in and trying to remove teeth, because slowly over time, if you're not taking care of their teeth, they're just going to end up losing them. So, and that's about it. Thanks.